Hello, everyone. Welcome back to Dr. Roche, Legal Nurse Consultant, where we are discussing how to pass your NCLEX exam. All right, so we were going through our priorities. If you haven't seen my previous videos, please go check them out now. We are on the priority of C, which is circulation. So the first thing we think about when it comes to circulation issues, some things that come to mind would be like a mass trauma. Maybe it's going to be a severed leg and there's bleeding everywhere. That's going to be a problem for sure. Maybe some internal bleeding is taking place. That could be an issue as well. But what about someone's blood pressure? If we look at the blood pressure, and again, we want to look at trendings, right? We have a person that's blood pressure is normally for that person be 140/90, and we're evaluating them and they're 110/60. We definitely have a big issue taking place. We have to look at the signs and symptoms of their patient. Do they have any? Do they get lightheaded and dizzy when they stand up or go from a lower position to a higher position? This can also be a priority when it comes to NCLEX questions. All right, so let's look at our question. Now, if you've been following along, you kind of know the steps that we're going to be doing, which is going to be first, read the entire question just to get an idea of what the question's asking. So, a nurse is assessing a patient who presents with signs of shock. Which of the following findings would be the most concerning and indicative of a worsening circulation status? All right, so we read the question. Now we're going to go back through. We're going to look at our very first sentence to figure out where are we at with things. A nurse is assessing a patient who presents with signs of shock. Well, this is nice because it tells us where we're at in the process to start with. Okay, so assessing. Now, when we get to signs of shock, yes, when it comes to our ADPI, we're in assessing, but when I see this, I'm starting to think we might be going into a priority. Where will we be at in that priority? Well, you probably guessed it. We're looking at maybe a circulation issue, right? Okay, which of the following findings would be the most concerning, again, keyword here, most concerning, and indicative of a worsening circulatory status? We're going to end this question knowing that we're in the priority and we are in circulation. All right, let's take a look at our answer choices. Heart rate of 110 beats per minute, blood pressure of 88/60, skin temperature of 98.6, capillary refill time of 4 seconds. Now, let's take a look and see what's going on circulatory-wise. Well, this one really doesn't have anything to do with circulatory, number one. Number two, it's a good temperature. Now, if this would be out of norm temperatures, maybe cooler, we could definitely look at that and say maybe that might be a circulation. But right now, that's out. Capillary refill of 4 seconds. That's a circulatory problem, right? It's supposed to be less than 3 seconds. All right, so we're going to keep that one in mind. Heart rate of 110 beats per minute. Okay, maybe the heart's beating a little faster to compensate for some blood loss. Maybe. Blood pressure of 88/60 millimeters of mercury. Out of all of these, which one do you think it is? If you guessed the low blood pressure of 88/60 millimeters of mercury, you are correct. Let's look at the rationale. All right, so blood pressure of 88/60 indicates hypotension, which is a critical sign of indicated circulatory status and can be indicative of a worsening shock. These findings suggest that the patient's circulatory system is struggling to maintain adequate perfusion and can be a sign of severe shock. Now, the heart rate being 110 beats per minute and the capillary refill time of less than 3 seconds, so it's 4 seconds, are also concerning and suggest possible circulatory issues. Blood pressure reading is the most immediate indicator that this person is starting to decompensate. Skin temperature was within normal limits and does not indicate acute problem with circulation. All right, I hope you liked this video. Please, 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 if you like this video, click like. Please click share so we can share some more information with others. Also ask that you leave a comment and provide me with some suggestions of some upcoming videos that you would like to see. Think about doing some nursing math teaching, very simple nursing math. But again, I need to know what your suggestions are. And I just also want to say thank you to everyone who is viewing this video. Also, please check out the description that's going to be underneath this video. I'm going to have a couple links for you to click there. I have some free sheets for you that's going to help you study with the NCLEX. So please get those, check them out. They're free, no strings attached whatsoever. All right, everybody, I hope you have a great day. Take care.